10 News Network. Myself, Singita, and today we are at Kailash Hospital. We have with us Dr. Manish Mahajan, not only a kidney health specialist but also expanding into general health issues, including the alarming rise in heart attack among the young people. So, first of all, welcome to 10 News Network.
Yeah, thank you, Sangita ji. Myself, Dr. Manish Mahajan, Senior Consultant Nephrologist at Kailash Group of Hospitals. And also thank you for 10 News to consider me to give my point of view on health issues and most importantly alarming health issues, be it kidney or be it non-kidney patient. An important factor which we are seeing in young adult is a cardiac arrest, which is in a rising phase.
So, as you talked about kidney problems caused by diabetes and high blood pressure, so what early warning signs should people look for, and how do these conditions quietly harm people?
First, we have to categorize kidney problem into three segments. The first segment, if the patient is non-diabetic and non-hypertensive, suppose if the patient is not having any diabetic issue or not having any BP issue, in those kind of patient, obviously lifestyle matters a lot. First, second thing, food habits, which is very important, and third thing, which you see in our society, lot of quacks or Neem and Hakim, they are practicing local medications in a locality. And if you go to tier 2 cities and tier 3 cities, wherein you'll get lot of kidney patient, because even if they are getting fever or joint pain or any other associated infection or inflammation, what they do, they go to the nearby doctors who are practicing as Ayurvedic doctor or maybe as a Unani doctor, and they don't hold a valid degree as such. So then they are being prescribed desi medications, which I'm totally against of. I'm not against of desi medications which are made at home, like if you talk about the home remedies. So over there, over abuse of pain medications and over abuse of desi medications at by local doctors and quacks, they lead to a rise of kidney problems in those populations. And I see in my general practice, I see more of a kidney problem patient, those who are non-diabetic and non-hypertensive. They are coming from tier 2 and tier 3 cities, because they go to those doctors just to save their money, because they get a general consultation in worth 50 rupees to 100 rupees. Just to save a little bit of money, they develop kidney problems. And the third thing, which you see that people are becoming very busy and it's a competitive world. They do not get time to eat home cooked food. So what they do, they eat mostly outside foods, packed food. Like you see, packed chips and packed foods which are quite abundant in our area, and these are easy to get over the counter foods, right? People they try to save their time by having these packed foods. They also give rise to a lot of kidney problems as well as diabetic problems as well as hypertensive problems. And the second category, which I would say a diabetic patient but not hypertensive patient. All right, so 67% of population in diabetic pool, like if giving an example, if 100 people are suffering with diabetes, only 33% of diabetic people are getting controlled by the medications. 67% are non-controlled. If their diabetes is not controlled, so that leads to a cardiac as well as renal problem in the long run. And third category, which I would like to highlight, somebody who is non-diabetic but the patient is hypertensive. And in those pools which we have seen, due to our lifestyle disease as well as stress, anxiety, and plus cooked food, high salt food, and majority, like more than 80% of especially Indian population above the age of 55, they develop subclinical hypertension. Their BP is usually more than 130 to 90, and generally these kind of hypertensive, they do not experience any symptoms. Then that leads to renal problem as well as a cardiac problem in those particular patients. And in those pool, I would like to mention only 8% of Indian population, only out of 100% of hypertensive, only 8% of Indian population, they develop renal problems, and they do not are able to control their hypertension even though they are taking medications. So what I feel in these three: first, lifestyle, sedentary lifestyle, anxiety, stress on first; second thing, controlling diabetes; third thing, hypertensive; and the fourth category which comes is somebody who has got all: sedentary lifestyle, somebody who is diabetic, somebody that also have hypertensive. As I previously mentioned, they are not properly controlled because they go to the local doctors. They do not reach to the certified practitioner wherein their diabetes should be controlled or hypertension should be controlled. So all these factors collectively give rise to renal and kidney problems as well as the cardiac problems, which we are seeing at this era, that most of the young adult population also having diabetic as well as renal problems. There is exponentially rise in cardiac as well as renal problems, even in the younger adult population apart from the older populations. And the fifth, which is the very important thing, due to our lifestyle, obesity also remains a major issue. Obesity has been now classified as a chronic disease, adipose-based chronic disease in our world. And so when many people, especially in Indian population, which we have seen obesity is on the rise, obesity also causes a lot of cardiac problems in patient as well as the renal problems in the patient. So being fit, doing exercise, yoga, and controlling your fat and obesity is also one of a very important marker to prevent from the kidney problems.
So what lifestyle tip you would like to give the people, especially who have family history of kidney and heart problems?
Yes, generally, as we know that lifestyle, genetic, they also predispose to the hypertensive as well as the type 2 diabetes as well. Somebody whose family is mother and father both are diabetic, there are high chances of the kids developing diabetes as well as hypertensive. So as we know that if our parents and ancestors are having this kind of problem, so we must abide by strict diet control, low salt diet, diabetic diet, right from the beginning. We can prolong it, we can delay it, right, with our lifestyle disease as well as dietary changes and lifestyle changes. Yoga, exercise, meditation is one of the mainstay in those patients. They can control or they can prevent these diseases to a much extent. And other important factor, as I just mentioned about obesity is also one of the cause for giving rise to type 2 diabetes as well as hypertensive patient in those pool. And the third one, stress and anxiety. India has become very competitive. Everybody wants to have a good career, and jobs as well as stress in the work environment as well as in the home environment, they also give rise to all this kind of. So stay away from here, stress, anxiety, and modify your dietary habits as well as lifestyle. Say no to outside food and packed food for sure.
So many young adults in India are nowadays facing heart attacks and heart problems. So according to your experience, what were the reasons for this and how they should cure it?
Yeah, it's exactly the lifestyle disease. It's a lifestyle thing. It's strongly linked to lifestyle as well as it is strongly linked to the dietary habits which we have developed in last few years. The more we go outside of the nature, the more we develop a lot more diseases. Like stay intact to the nature, eat green foods, green vegetables, and home cooked food is very important. But the younger adult, if you see right from the age of 3 or 4, they are asking for pizza and outside food, and the parents to just to give them a taste, outside foods are allowed in the house. And right from the beginning, of the growing child and a kid or toddler, they have developed eating of outside food, and it is as much as 40% of the total intake of their food in their lifestyle. In their life, they eat 40% of the food from outside. That is one of the very strong cause of developing cardiac problem, as well as second thing, obesity, as I just mentioned. Third thing is stress and anxiety. So stay away from all these things and develop a healthy lifestyle to stay away from any cardiac problems. And these are one of the reasons why young adults are developing a lot of cardiac attack. Also artificial foods, plus many people are going to the gym and all, they are taking overuse of any drugs or any protein powders are also linked to developing all these problems.
So, how often should someone who seems healthy but maybe live a stressful or inactive life get healthy kidney or a heart checkup?
There are two things. You said somebody who is healthy but not living a healthy life. So you said somebody who is healthy and not living an active life. Somebody who is not living an active life is not healthy at all. So, and living an active life is strongly linked to a healthy lifestyle as well. So, what I say, 10 to 15,000 steps in a day is what I mean, a very active lifestyle, and that will keep you very active. And dietary modification, and say no to outside food, say no to non-veg, strictly adhere to the vegetable foods and high protein diet. That will keep you happy, and that will keep you out of the infection. And always go for a recommended diet. Somebody whose BMI is less and somebody whose BMI is more, so they should adhere to the dietary lifestyle according to their BMI. Somebody who is obese must lose their weight and remain fit and be healthy.
Thank you so much, sir, for talking with 10 News and sharing such valuable insights with us.